femur. We can see the acetabulum articulates with the head of femur or the femoral head here. With this acetabulum articulate with each other. We take a close look at this anterior view and posterior view of the femur bone. Firstly, let's take a look at this bone. The anterior view, upper lobe. The femur bone is a typical long bone. It has two ends, upper end, lower end, and shaft of femur. This the upper end, we can see here is the femur head, forehead of femoral head, the neck of femur. There are two greater trochanter. Greater trochanter, and there are two elevation is a greater trochanter and a lesser trochanter. Between these two trochanter, there is the intertrochanteric line anteriorly, and intertrochanteric crest posteriorly here. Okay, this is the posterior view. The lower end of a femur bone is here. We can see the smooth surface, patella surface. The bone of a patella touch with hip bone here. So we call it patella surface. We can see this side is the lateral side, this is the medial side. So this epicondyle is the lateral condyle. Here is the medial epicondyle. Above it, there is another adductor tubercle. Here is the lateral condyle. This view is the posterior view of a femur. We can see this is in the trochanteric crest. This is the gluteal tuberosity. It also provides attachment to glutinous mechanism. Here is the pectineal line, linea aspera. The medial and lateral lips. This surface is the popliteal surface, and this is the lateral and medial condyle. This fossa is the intercondylar fossa. Fracture always occur at the head of femur. As we become aged and old and older, our bone becomes spongy. It lost many compact substance. It become fragile, and fracture always occur here. Patella. Patella is the biggest sesamoid bone. Here is the base of patella. Here is the apex of patella, articular surface of patella. It is angular. Now, we will talk about the bone, tibia and fibula. Here is the tibia medially. Here is the fibula laterally. The upper end of tibia is the intercondylar eminence, this elevation. The lateral condyle, medial condyle here. This tuberosity is tuberosity of tibia. We can see the interosseous border. And this is the shaft of tibia. Medially, this is the medial malleolus. Medial malleolus. This is the anterior view of tibia. This one is the posterior view of tibia. We can see this is the fibular articular facet. It will articulate with the fibula here. This line is a soleal line. In this slide, we mainly see the tibia. Here is the fibula. This is the fibula head, neck of fibula, shaft of fibula. This line is in the osseous border. It provides attachment for the interosseous membrane between fibula and tibia. This is the lateral malleolus. This is the intermalleolus, lateral malleolus. Okay, let's move on to talk about a bone of a foot. The bone of a foot consists of 7 short bones. They are arranged in 3 rows, from anterior to posterior. The first one, the first row is this anterior row. It consists of the medial cuneiform, this medial cuneiform bone, intermediate cuneiform bone, and lateral cuneiform bone. Laterally, this one is the cuboid bone. This is the anterior row. The middle row is the navicular bone, this one. This is the intermediate row. Posterior row include talus and coccygeus. This bone is the upper view of our foot. This is the inferior view of our foot. This is toe, and 3 for each of the other. 1, 2, 3. Proximal, intermediate, and distal for length.